Adolescent mental health. So this is just some general information. Dopamine is a neurotransmitter. It's a chemical that transfers information between brain cells. It's believed that mental health challenges related to marijuana use are related to the drug's impact on dopamine. So dopamine is the message sender, and it's kind of the feel good hormone or feel good chemical. And if you have something messing with that, then it's going to have an impact on how you behave, right, and how you feel towards whatever that thing is that's messing with the dopamine levels. There's an established link between marijuana use and an increased risk of mental health disorders, schizophrenia, depression, anxiety in individuals who are genetically predisposed. And again, as I was saying earlier, a lot of researchers are now just right on the cusp of saying even people who weren't genetically predisposed, even people that literally have no mental illness in their body, cannabis is causing it. So you're going to hear that language start to come out more and more at conferences and at trainings. I don't have, again, my research isn't cutting edge in the last 2 weeks, but there's quite a bit that's come out in the last couple of months that says, yeah, it's a little more than people who were already struggling, making it worse. Now we're talking about a cause and effect. And again, the word marijuana, I use marijuana in these because that's what's in the article itself. If it were me just saying this, I'd use the word cannabis. A causal relationship between cannabis use and depression has been elusive. However, use is associated with a higher risk of severe mental health challenges adolescents experience. Really, there is absolutely no adolescent mental illness that cannabis makes better. We might hear teens say, oh, it makes my anxiety go away. So does alcohol. Yeah. I mean, so does punching somebody. So does a lot of the negative behaviors that people can sometimes exhibit that help alleviate their anxiety in the short term. Yeah, cannabis might do that for you. It might make it so that your adolescent or your anxiety is decreased. However, the bounce back effect, the boomerang effect is going to be massive. It makes anxiety worse in the long run. When the episodes happen, a person who's been using cannabis, things get worse for them. The bottom line, despite popular public opinion, cannabis use has not been proven to alleviate any adolescent mental health issues. In fact, it's been proven to make matters worse for any existing mental health challenges. There's not a single organization out there who has come out and said, oh, we fully endorse cannabis use for young people to treat this mental illness. There's just not a legitimate medical group out there. There might be some fringe groups, again, some cannabis trade groups or some things like that. But when it comes to physicians and doctors and researchers and mental health practitioners, there's not a single legitimate group that's come out and said, hey, cannabis helps teens' mental health in this way. Okay, so there might be a short-term impact, but or a short-term improvement. The long-term improvement is just ugly. One of the other things, I didn't put the slide in here, but even with like bipolar disorder, if you know how bipolar disorder usually shows itself, there's kind of waves. There's highs and then there's lows, and then there's highs and then there's lows. And sometimes there's just normalcy, normalcy, kind of that base level of I'm not feeling super happy. I'm not feeling super sad. I'm just feeling like it's a day. I'm just getting through today. With cannabis use, what's been shown is those manic episodes, whether they're highs or lows, get closer together. They get faster and the peaks get higher and the valleys get lower. So if you can imagine a person who's struggling with bipolar using cannabis and the THC is impacting their mental illness, all of a sudden their happiers are even happier and their sadders are even sadder. And those things are happening faster. So if that cycle used to happen every day or every couple of days or once a week or however it would kind of manifest itself, now it's happening on an almost hourly basis. And I don't know about you as an adult, I don't think I could handle that for very long. As an adolescent, it's got to be hell on wheels. So there's really no adolescent mental illness that cannabis has been shown to help in the long run, despite popular public opinion.